You wake up on a Saturday morning. No alarm. You slept a full 8 hours, and yet you feel like you ran a marathon in your sleep. Your legs are heavy, your brain is wrapped in cotton wool. You shuffle to the kitchen, pour the coffee, and think, maybe I'm just getting old. You're not just getting old. What if I told you that right now, as you're watching this, there is a very high chance that your body is running dangerously low on at least two essential vitamins? Not because you eat badly, not because you're doing something wrong, but because after 40, your body quietly changes the rules of the game, and nobody sends you a memo. Here's what floors me after 17 years of practice. I've seen thousands of patients walk through my door complaining about fatigue, joint pain, brain fog, mood swings, muscle cramps, thinning hair. And in the vast majority of cases, the vast majority, they'd already been to another doctor. They'd already been told it's stress, or age, or let's keep an eye on it. And not a single one of them had been checked for the 5 deficiencies I'm about to walk you through today. 5 vitamins. That's it. 5 substances that your body cannot manufacture in sufficient quantities after a certain age, and that control everything from your heartbeat to your ability to remember where you put your keys. Now, a small but important thing before we dive in. Nothing I say in this video replaces a proper blood panel and a face-to-face conversation with your own physician. I'm giving you the map. Your doctor gives you the coordinates. Those are 2 different jobs, and both matter. Clear? Good. Hit subscribe right now and tap that like button. We're pushing toward 300,000 subscribers, and this channel exists for one reason. Because the 14-minute appointment you get at the clinic was never designed to cover what I'm about to spend the next 25 minutes explaining. So if this matters to you, that button matters to me. Now, let's talk about what your body has been trying to tell you. The first deficiency, and the one I consider the silent epidemic, is vitamin D. And I already know what you're thinking. Mark, I've heard this 1,000 times. Vitamin D, sunshine, bones, I know. But here's what you probably don't know. Vitamin D is not really a vitamin. It's a hormone. Your body manufactures it when ultraviolet B radiation hits your skin and triggers a chemical conversion in your liver and kidneys. It functions more like a master switch. It regulates over 1,000 genes in your body. 1,000. Not 12, not 50, 1,000. Now think about this. After the age of 40, your skin's ability to synthesize vitamin D from sunlight drops by roughly 50% compared to when you were 20. 50%. Same sun, same skin, half the output. By the time you're 70, that number drops even further. Some studies put it at 75% less efficient. Your body is literally losing its ability to do the one job it's been doing since you were born. And here's where it gets interesting. Vitamin D isn't just about bones. That's the postcard version. The real story is that vitamin D receptors exist in virtually every tissue in your body. Your heart, your brain, your immune cells, your pancreas, your muscles. When those receptors don't get enough of the hormone, things start to quietly malfunction. Your immune system gets sluggish. Your mood dips. Your muscles weaken, not from lack of exercise, but from lack of signal. Think of it like a radio tower. The music is still playing, but the antenna is broken. The signal doesn't reach the speakers. And the data is striking. Depending on your latitude, your skin tone, and your indoor lifestyle, estimates suggest that somewhere between 40 and 60% of adults over 50 are deficient in vitamin D. Not insufficient, deficient, clinically low. And most of them have no idea. Let me tell you about a patient I'll call Margaret. 61 years old, retired school principal. Sharp as a tack. Came to see me because she'd been falling. Not dramatic falls, just little stumbles. Catching her foot on the edge of the carpet, missing a step on the stairs. She'd been to an orthopedist who checked her knees. She'd been to a neurologist who ran an MRI. Everything came back clean. When she sat in my office, she said, and I remember this, "Mark, I feel like my legs just forgot how to be legs." I ran a full panel. Her vitamin D level was 14 nanograms per milliliter. The optimal range starts at 40. She was a third of the way there. Her muscles weren't weak from disease. They were weak from starvation. hormonal starvation. We started supplementation, adjusted her dose over 8 weeks, and within 3 months, the stumbling stopped. Not reduced, stopped. Now, what do you actually do about this? The Sunshine Protocol. If you live above the 35th parallel, that's roughly the latitude of Memphis, Tennessee, or Tokyo, your skin cannot produce meaningful vitamin D from sunlight between October and March. Full stop. The sun is too low. The UVB rays don't penetrate the atmosphere at the right angle. So for roughly half the year, you're running on reserves. And after 40, your reserves are smaller. Step 1. Get tested. Ask your doctor for a 25-hydroxy vitamin D blood test. Not the active form, the storage form. That's the one that tells you how full your tank actually is. You want your number between 40 and 60 nanograms per milliliter. Not 20, not 30, 40 to 60. Step 2. Supplementation. For most adults over 40 who are deficient, the clinical literature supports a daily dose of between 2,000 and 4,000 international units of vitamin D3. That's the form called cholecalciferol. Take it with a meal that contains fat. A splash of olive oil on your salad, a handful of nuts, even a piece of cheese. Vitamin D is fat-soluble. Without fat, it passes through you like a tourist who never gets off the bus. Step 3. Pair it with vitamin K2. This is the step most people miss and most doctors forget to mention. Vitamin D increases calcium absorption. Great, but without K2, that calcium can end up depositing in your arteries instead of your bones. K2 is the traffic cop. It directs the calcium to the right address. 100 to 200 micrograms of K2 in the MK7 form taken with your D3. 1 capsule, once a day. Costs less than a cup of coffee per week. Step 4. Retest after 3 months. Not 6, 3. You want to see movement. If your levels haven't budged, the dose needs adjusting. And that's a conversation for your doctor, not for a comment section. A quick caution. If you take blood thinners like warfarin, talk to your physician before adding K2. It affects clotting pathways. For everyone else, this combination is safe, cheap, and profoundly effective. Sound familiar so far? Good, because we're just getting started. And the next deficiency is one that almost nobody talks about, and it's arguably more dangerous. Magnesium, the invisible mineral. I call it invisible because it is involved in over 300 enzymatic reactions in your body. 300. And yet it doesn't show up accurately on a standard blood test. Let me say that again. The most commonly ordered blood test for magnesium, serum magnesium, only measures the 1% of magnesium that floats in your blood. 99% of your magnesium is inside your cells, your bones, your tissues. So you can have a normal blood test and still be profoundly deficient at the cellular level. This is one of the great blind spots in modern medicine. Why does magnesium matter so much? Because it is the gatekeeper of your electrical system. Every nerve impulse, every muscle contraction, every heartbeat depends on magnesium to regulate the flow of calcium and potassium through cell membranes. Without enough of it, your muscles cramp, your heart rhythm can skip, your sleep deteriorates. Not because you're anxious, but because your nervous system physically cannot downshift into rest mode. Think of magnesium as the dimmer switch on your lights. Without it, your body is stuck on full brightness 24 hours a day. And here's the kicker. Modern farming has depleted magnesium from our soil. The wheat your grandmother ate in 1960 contained roughly 30% more magnesium per serving than the wheat you buy today. The food hasn't changed in name, it's changed in substance. You're eating the same foods your parents ate and getting less nutrition from every bite. After 40, your kidneys also become less efficient at retaining magnesium. They start letting more of it leak into your urine. So you're getting less from food and losing more through your kidneys. It's a pincer movement, and your body is caught in the middle. Studies estimate that up to 68% of American adults do not meet the recommended daily intake of magnesium. 68%. That's not a niche problem, that's a population-wide deficit. Now, I want to hear from you on this one. Drop a comment and tell me, do you get muscle cramps at night? Yes or no? I'm not asking for fun. I'm building a picture of this audience, because the frequency and location of your cramps tells me a lot about what content I need to make next. One word: yes or no. That's all I need. Let me tell you about Gerald, 72, retired electrician. Came to see me because his heart was doing funny things. He'd feel these little flutters, like a bird trapped in his chest, usually in the evening, usually after a long day. His cardiologist had done an ECG, a Holter monitor, an echocardiogram. Everything was structurally fine. They put him on a low-dose beta blocker and sent him home. When I asked Gerald about his diet, his sleep, his hydration, the stuff nobody asks about, it turned out he'd been drinking 4 cups of coffee a day, eating almost no green vegetables, and his nightly leg cramps had become so routine he thought they were just a thing that happens when you get old. I checked his red blood cell magnesium level, not his serum level, the intracellular one, and it was in the basement. We started with magnesium glycinate, 200 milligrams before bed. Within 3 weeks, the palpitations dropped by about 80%. Within 6 weeks, they were gone. His cardiologist was surprised. I wasn't. The Magnesium Rebuild Protocol. Week 1. Start with 200 milligrams of magnesium glycinate or magnesium taurate in the evening, roughly 30 minutes before bed. These 2 forms are the best absorbed and the gentlest on your stomach. Avoid magnesium oxide. It's cheap, it's everywhere, and it has an absorption rate of about 4%. You're basically paying to make expensive urine. Week 2. If you tolerate it well and your symptoms haven't shifted, increase to 400 milligrams, split into 2 doses, 200 in the morning, 200 before bed. Week 3 and beyond. Maintain the dose that works. Most adults settle between 300 and 400 milligrams daily. Add magnesium-rich foods as a foundation. Pumpkin seeds are the king here. 30 grams of pumpkin seeds deliver about 150 milligrams of magnesium. Throw them on your porridge. Eat them from a bowl. They cost next to nothing. Dark chocolate with 70% cocoa or higher is another excellent source, about 65 milligrams per ounce. So yes, I'm prescribing chocolate. You're welcome. Caution: if you have kidney disease, magnesium supplementation requires medical supervision. Your kidneys regulate magnesium excretion, and if they're compromised, levels can build up. Talk to your doctor first. And here's the thing that gives me genuine optimism about this deficiency. It responds fast. Magnesium is not one of those nutrients that takes 6 months to show results. Most of my patients notice a difference in sleep quality and muscle tension within 7 to 14 days. That's not a placebo. That's biochemistry. Number 3. And this one quietly destroys people's quality of life for years before anyone catches it. Vitamin B12. The stealth deficiency. B12 is essential for 2 things your body absolutely cannot do without: making red blood cells and maintaining the myelin sheath around your nerves. Myelin is the insulation on your electrical wiring. When it degrades, signals misfire. You get tingling in your fingers, numbness in your feet, memory lapses that feel like early dementia but aren't, fatigue that sleep doesn't fix. Here's the mechanism that matters for anyone over 40. Your stomach produces a substance called intrinsic factor, a protein that binds to B12 in your food and carries it into your bloodstream through the wall of your small intestine. Without intrinsic factor, B12 just passes through you. And here's the problem. After 40, your stomach gradually produces less hydrochloric acid and less intrinsic factor. By the time you're 60, your absorption efficiency may have dropped by half. So even if you eat a steak every night, which is one of the richest sources of B12 on the planet, you might only absorb a fraction of what's in it. And if you take a proton pump inhibitor, the acid-blocking medications for reflux, the ones with names ending in prazole, you're accelerating this process dramatically. Those drugs suppress stomach acid by design. That's their job. But stomach acid is exactly what you need to liberate B12 from food. I have seen patients on long-term acid blockers whose B12 levels had dropped so low they were developing neurological symptoms, and no one had connected the dots. The numbers are staggering. Up to 20% of adults over 60 are estimated to be B12 deficient. In some populations, vegetarians, vegans, people on long-term acid blockers, people with autoimmune gastritis, the number is even higher. I had a patient, let's call him David, 67, former university professor, came in because his wife had noticed he was forgetting words. Not forgetting names, forgetting common words. He'd pause mid-sentence and reach for a word like kettle or Wednesday, and it just wouldn't come. He was terrified it was Alzheimer's. His wife was terrified. They'd already looked into memory clinics. I ran a B12 level. It was 93 picograms per milliliter. The functional minimum is around 300. He was catastrophically low. And he'd been on omeprazole for reflux for over 9 years. 9 years. We started B12 injections, 1,000 micrograms intramuscularly, weekly for 4 weeks, then monthly. Within 6 weeks, his wife called my office to say, and I'm paraphrasing, "I have my husband back." The word finding came back. The fog lifted. He wasn't developing dementia. His brain was starving. The B12 rescue protocol. First, get tested. Ask for a serum B12 level and, if possible, a methylmalonic acid test. Methylmalonic acid rises when B12 is functionally low. It's a more sensitive marker. If your B12 is below 300, even if it's in range on the lab printout, you should be supplementing. Many functional medicine practitioners consider optimal to be between 500 and 900. For mild deficiency, 1,000 micrograms of methylcobalamin. That's the active bioavailable form, taken sublingually, under the tongue. Not swallowed, under the tongue. The tissue there absorbs it directly into your bloodstream, bypassing the stomach entirely. This is important for people over 50 because it sidesteps the intrinsic factor problem altogether. Once a day. Let it dissolve fully. Takes about 60 seconds. For moderate to severe deficiency, talk to your doctor about intramuscular injections. They are the fastest route to replenishment, and for people with absorption issues, they may be the only reliable option. Cost. Sublingual B12 tablets. A bottle of 60 costs roughly $8 to $12. That's 4 months of treatment for the price of a single copay. Caution. B12 supplementation is extremely safe. There is no established upper toxicity limit. However, and this is important, if you are being treated for any condition that involves rapid cell growth, including certain cancers, discuss supplementation with your oncologist. B12 supports cell division. In the wrong context, that's not always what you want. Okay, let's keep going. Number 4, and this one surprises people, omega-3 fatty acids. Now, technically, these are not a vitamin. They're essential fatty acids, but they are so consistently deficient in adults over 40 and so critical to so many bodily functions that leaving them off this list would be medical malpractice on my part. I'm including them because your body needs them, your body cannot make them, and you are almost certainly not getting enough. There are 2 omega-3 fatty acids that matter clinically, EPA and DHA. EPA is primarily anti-inflammatory. DHA is primarily structural. It's a building block of your brain tissue, your retinas, and your cell membranes. Together, they are the lubricant for your entire system. Without adequate levels, inflammation rises, joint stiffness increases, brain processing slows, your cell membranes become rigid. Imagine a door hinge rusting shut, and nutrient exchange across the membrane becomes inefficient. After 40, chronic low-grade inflammation becomes the default state for most people. Researchers call it inflammaging, a wonderful and horrifying word. Your immune system starts producing more pro-inflammatory signals even in the absence of infection. Omega-3 fatty acids are one of the most effective natural counterweights to this process. They don't just reduce inflammation, they actively resolve it. There's a class of molecules derived from EPA and DHA called specialized pro-resolving mediators, SPMs, that physically signal to your immune cells, okay, stand down, the fight is over, clean up and go home. Without enough omega-3s, that signal never arrives. The inflammation just simmers. Here's a number that should concern you. The average Western adult has an omega-3 index, that's the percentage of EPA and DHA in your red blood cell membranes, of about 4 to 5%. The target for cardiovascular protection is 8% or above. Most people are operating at half the recommended level, and the research linking low omega-3 index to increased risk of heart disease, cognitive decline, and depression is robust and growing. Ever wondered why your grandmother swore by cod liver oil? She didn't have the science, she had the observation, and she was right. The omega-3 rebalancing protocol. Option 1. Food first. Fatty fish is the gold standard. Salmon, mackerel, sardines, anchovies, herring. 2 to 3 servings per week of fatty fish delivers approximately 250 to 500 milligrams of combined EPA and DHA per serving. Canned sardines are phenomenal. They're cheap, they're shelf-stable, and because you eat the bones, you also get calcium. A tin of sardines is a multivitamin with a pull tab. Option 2. Supplementation. If you don't eat fish regularly, a high-quality fish oil or algae-based omega-3 supplement is the next best option. Look for a product that provides at least 1,000 milligrams of combined EPA and DHA per dose, not 1,000 milligrams of fish oil. Read the back of the label. Many cheap fish oil capsules contain 1,000 milligrams of total oil, but only 300 milligrams of actual EPA and DHA. That's like buying a bottle of juice that's 70% water. Take your omega-3s with your largest meal of the day. Fat content in the meal improves absorption by up to 300%. Store the capsules in the freezer. It prevents the fishy aftertaste and slows oxidation. If you're vegan or allergic to fish, algae-based DHA and EPA supplements are derived from the same microalgae that fish eat. You're going straight to the source. Slightly more expensive, but equally effective. Caution: if you take blood-thinning medications, high-dose omega-3s, above 3 grams per day of EPA and DHA combined, can enhance the anticoagulant effect. Moderate doses of 1 to 2 grams per day are generally safe, but inform your doctor. And now, the 5th deficiency, the one that hides in plain sight, the one that affects your bones, your teeth, your blood pressure, and your nerve function, and that most people dismiss because they think they're already getting enough from food. Potassium. Not a vitamin either, it's a mineral. But like omega-3s, its deficiency is so widespread and so consequential after 40 that ignoring it would be irresponsible. Potassium is an electrolyte. It carries electrical charge across cell membranes. Every heartbeat is a potassium event. Every nerve signal, every muscle contraction. Your heart is a muscle, which means your heart rhythm is literally dependent on adequate potassium levels. The recommended daily intake for adults is 4,700 milligrams. 4,700. And the average American gets about 2,400. That's roughly half. The average diet delivers half the potassium your body needs to run its electrical systems at full capacity. And this isn't about eating badly. Potassium is hard to get from food unless you're intentionally eating specific things. Here's a number that most people find shocking. A single banana, the food that everyone associates with potassium, contains approximately 420 milligrams. To hit your daily target from bananas alone, you'd need to eat 11 bananas a day. 11. Nobody is doing that. And if you were, the sugar load would create its own problems. After 40, the issue compounds. Blood pressure tends to rise. Many people end up on diuretics, water pills, that flush potassium out of the body along with excess fluid. So now you're already low, and your medication is making you lower. This is one of the most common drug-nutrient interactions in medicine, and it is chronically under-monitored. Here's how potassium and sodium interact. And this is the piece that changes everything. Your body maintains a ratio between sodium and potassium. When sodium is high and potassium is low, your blood vessels constrict, your blood pressure rises, and your kidneys retain water. When potassium is high relative to sodium, the opposite happens. Blood vessels relax, pressure drops, and fluid balance normalizes. The ratio matters more than the absolute numbers. You can reduce your sodium all you want, but if your potassium is still in the basement, the equation doesn't balance. Think of it like a seesaw in a playground. Sodium sits on one end, potassium on the other. Most people are trying to fix the problem by removing weight from the sodium side. But the faster, more effective solution is to add weight to the potassium side. Bring the seesaw level from the other direction. The Potassium Restoration Protocol. This one is almost entirely food-based, and intentionally so. Potassium supplements are limited to 99 milligrams per tablet by regulation, which means you'd need 47 pills a day to hit your target from supplements alone. That's not a protocol, that's a part-time job. Food is the vehicle here. Top sources ranked by potassium per reasonable serving. White beans. 1 cup cooked delivers approximately 1,000 milligrams. That's over 20% of your daily target from a single side dish. Potatoes. 1 medium-baked potato with the skin on provides about 900 milligrams. The skin matters. Don't peel it. Spinach. 1 cup cooked gives you approximately 840 milligrams. Avocado. 1 whole avocado delivers about 700 milligrams. Sweet potatoes. 1 medium provides about 540 milligrams. Salmon, another reason to eat it, about 500 milligrams per fillet. The Daily Potassium Blueprint. Week 1. Audit your current potassium intake. Write down what you eat for 3 days and look up the potassium content. You'll be stunned at how low the number is. This step alone is revelatory. Week 2. Add 1 high potassium food to each meal. White beans with lunch, a baked potato at dinner, spinach in your morning eggs. This isn't a diet overhaul, it's a targeted addition. Week 3. Add a glass of coconut water in the afternoon, not the sweetened kind, pure coconut water. 1 cup contains approximately 400 milligrams of potassium with negligible sugar. It's nature's electrolyte drink. Week 4 and beyond. Maintain these additions as a permanent baseline. Most of my patients, once they start tracking potassium, are shocked at how much better they feel within 2 weeks. Fewer cramps, lower blood pressure readings, more stable energy. Caution, and this is critical. If you have kidney disease or take potassium-sparing medications like ACE inhibitors or certain diuretics, do not increase your potassium intake without medical supervision. Your kidneys regulate potassium excretion, and too much potassium with compromised kidneys can cause dangerous heart rhythm disturbances. This is one of the few cases where more is genuinely not better without medical clearance. Now, let me bring this all together for you, because I know that was a lot of information, and your brain is probably doing that thing where it remembers the first thing and the last thing, but the middle is getting fuzzy. Totally normal. That's why I'm giving you the cheat sheet right now. The 5 Deficiencies cheat sheet. Screenshot this, write it down, stick it on your fridge, whatever works. Vitamin D. Get your 25-hydroxy level tested. Aim for 40 to 60 nanograms per milliliter. Supplement with 2,000 to 4,000 IU of D3 daily, taken with fat. Add 100 to 200 micrograms of K2 in MK7 form. Retest at 3 months. Magnesium. Start with 200 milligrams of magnesium glycinate before bed. Increase to 400 milligrams if needed. Split morning and evening. Eat pumpkin seeds daily, 30 grams. Avoid magnesium oxide, low absorption. Vitamin B12. Test serum B12 and methylmalonic acid. Optimal is 500 to 900 picograms per milliliter. Supplement with 1,000 micrograms methylcobalamin sublingual daily. If severely low, discuss injections with your doctor. Omega-3 fatty acids. Eat fatty fish 2 to 3 times per week, or supplement with 1,000 to 2,000 milligrams combined EPA and DHA daily. Take with your largest meal. Store in the freezer. Potassium. Aim for 4,700 milligrams daily from food. Prioritize white beans, baked potatoes with skin, spinach, avocado, and coconut water. Do not megadose supplements without medical supervision if you have kidney issues. Red flags. When to see your doctor immediately. Chest pain or irregular heartbeat that doesn't resolve with rest. Numbness or tingling that is progressive, getting worse over days or weeks, not just a one-off. Severe muscle weakness that affects your ability to walk or grip. Confusion or cognitive changes that are sudden, not gradual. Any symptom that scares you. If it scares you, it deserves professional attention, period. Everything I've walked you through today supports what your body already knows how to do. These aren't exotic interventions. They're replenishing the raw materials that time, diet, and modern agriculture have slowly drained from your system. This is maintenance, not medicine. But, and I mean this, maintenance only works when you've first confirmed there isn't something deeper going on. If you haven't had a comprehensive blood panel in the last 12 months, make that your first step before you buy a single supplement. The blood test is the roadmap. Without it, you're guessing. And guessing with your health is a game with terrible odds. Now, I want you to do something for me in the comments. Tell me your age. Just a number. Nothing else is necessary, but the number matters to me. Here's why. This channel is growing, and I want to know exactly who I'm talking to, because the recommendations I make for someone who is 45 are different from the ones I make for someone who is 70. Your age changes everything. Your absorption rates, your risk profile, your medication interactions. So that single number helps me build the next video specifically for you. Drop it in the comments. One last thing. Nobody in the system, no insurance company, no pharmaceutical rep, no overworked GP with 14 minutes on the clock is going to sit with you for half an hour and walk you through this. Not because they don't care, most of them do care, but because the system isn't designed for prevention. It's designed for intervention. It gets paid when something breaks, not when you keep it from breaking. That's not cynicism, that's economics. And it's exactly why this channel exists. If this was useful to you, subscribe, hit the like. And here's the thing I actually care about more than either of those. Send this video to one person, one specific person. You know who I'm talking about. The one who's been tired for months and says it's just stress. The one who's been getting leg cramps and assuming it's normal. The one who hasn't had a blood test in 3 years. Send it to them. It might be the thing that changes their trajectory. I'm Tilden. I'll see you in the next one. Take care of yourselves.